Peri-implantitis is a significant long-term complication of dental implant patients. Systematic reviews have shown that peri-implantitis can be found in 10% of implants and 20% of patients. Contributing factors of peri-implantitis can be many, but the primary etiology is still the bacterial plaque. Studies consistently show that peri-implantitis are associated with inadequate or difficult access for plaque control, whereas implant sites with good plaque control are rarely found to have peri-implantitis. Plaque control is so important around implants, partly because peri-implant sulcus lacks junction epithelium. It also doesn't have any inserting fibers, and typical implant platform is placed more apical than the CEJ of a natural tooth. Another anatomical difference between a tooth and an implant is that the CEJ is scalloped, whereas the implant-abutment interface is flat. This makes plaque control below the peri-implant mucosa more difficult than around natural teeth. So I've come up with a novel flossing technique around an implant. Instead of getting the floss in approximately and getting below the mucosal margin, I get the floss on both sides of the interproximal, then crisscross the floss and lasso the entire crown. When you tug on the floss ends, it drops more apically due to the conical profile of the implant crowns. To test my theory, I used an ortholigature wire to floss around an implant crown in a traditional way. Then I used a new lasso technique. Using the standardized radiographs, I measured the apical displacement of the ligature wire and found that using the lasso technique, the wire reached further apical than the traditional technique. Now, combined with the 360-degree circumferential access to the implant crown, this flossing technique should provide more thorough plaque removal. Here's a demonstration of the flossing technique where I place the floss on both sides of the implant crown and a crisscrossed and a gentle tug placed on both ends of the floss, and then the floss is removed. Regardless of which plaque control technique is used, it is the responsibility of the surgeon and the restorative dentist to demonstrate proper flossing technique to our implant patients so that our patients can maintain optimal peri-implant health. If you like this content, please subscribe to my channel.